Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to share one simple exercise that can have significant benefits in improving your walking after knee replacement surgery. Before I jump into it, please hit that subscribe button and turn on the notifications so you can catch all things related to knee replacement surgery, exercises, rehab and recovery, preparation, frequently asked questions, and everything else in between. So when it comes to walking after knee replacement surgery, one of the biggest issues or differences is that your step length, or how long your steps are, tend to be decreased. And the reason for this is, one, because of range of motion deficits, so not having your full range of motion in the knee early on after surgery. And the other one is just having some pain in that leg and the knee that you had surgery on. So for those reasons, you might not necessarily want to spend as much time with all of your weight on that one leg, so you're going to take a smaller, kind of quick step like this. What we want to do is promote larger steps and even probably exaggerate how big your steps are when you're in therapy or doing this exercise. And then in turn, when you go out and walk alone or just normal walking, your normal steps will be closer to kind of what the normal step length is going to be. And we also want to promote this heel to toe walking. And all we mean by that is your first contact of your foot when it touches the ground should be your heel, and then the last contact is pushing off with the foot. So taking big steps, heel to toe walking, working on both will have that benefit of more normalizing your gait. So how do we do that? Well, basically the easiest way is to do an activity where you're walking over some sort of obstacle that is forcing you to take bigger steps. So today, I'm just using some TheraBands and a stretching strap, and I'm going to lay them out on the floor so they're spaced relatively far enough that I'm going to step over them one after the other. And I can encourage you to use anything that you have available. Yardsticks work great. Any type of, if you have therapy sticks I use in the clinic, you can use cones, anything that you have available, broomsticks, anything that's going to be that obstacle, that's something that you can use as a cue of where your foot's going to be, where you're stepping over. So start on one end, and then all you're going to do is step over the hurdles or whatever you're using as your obstacle. So you're going to step, remember that heel to toe contact, heel to toe contact, heel to toe contact. If you don't take a big step, what you're going to find is you're going to get yourself in trouble because you're going to end up landing either right on that hurdle, you're going to end up landing before that hurdle. So it's forcing you to take this bigger step to clear the hurdle and then come down, switch, and come over to this side. And you're just going to go back and forth and do that as much as you need to. And then you'll notice that this is almost a little bit exaggerated how big these steps are. And that's perfectly okay, because then when you go to take normal steps and are just walking normally, your body will compensate a little bit, and hopefully you'll end up somewhere kind of right within a normal step length. So just stepping over the hurdles, try not to touch the hurdles, try not to hit the hurdles, taking that big heel to toe contact steps. Easy enough, but can have really tremendous benefits in helping to improve your walking, your gait after knee replacement surgery. Thank you very much for watching. Please be sure to hit that like button to help spread this video to other viewers, and please leave your comments and questions below. I'll do my best to get back to everyone I see. Thank you very much.